Hello everyone, myself Meenal Agarwal. Welcome to my YouTube channel, The Zone of Anatomy. I created this channel to make anatomy easy to understand. So let's begin with the topic surface anatomy of back. So before starting, let us understand what the surface anatomy means. So it is basically the study of external anatomical feature of human body. Moving forward, let's review what all we are going to discuss in this video. Starting with the bones, we have to study 4 bones that are present at the back. That is starting with skull, then scapula, then vertebra, and the hip bone. Then we are moving forward to the muscles. We have 3 muscles: superficial, intermediate, and deep muscles. And lastly, we'll see there is a true triangle, that is auscultation triangle and the lumbar triangle. So starting with the triangle, since it is a small topic, we'll discuss over here itself. In the triangles, there is the auscultation triangle that is present at the scapular region. In the auscultation triangle, the main thing which we need to understand is that it is a point where we can hurt the impulse, or we can test it by the stethoscope. Second is the lumbar triangle, which is present at the lumbar region. Moving forward, now this is the regional anatomical overview of the human body at the back, starting with the scapular region. Scapular region is a region where our scapula is located. The region which is above the scapular region is the suprascapular region, and the region which is present below it is the infrascapular region. In this region, we have another region, that is the deltoid region. Deltoid region is marked as a 2, where the deltoid muscle is present. Moving downwards, we have the vertebral region where we have a vertebral column. Then we have a lumbar region, sacral region, and gluteal region. Gluteal region is the part where we have our hip bone located. So moving forward, after understanding this entire concept of the surface, or we say the region, now we move forward to this. So to solve this slide, we need to understand the bones first, then we'll move back to on this slide. So the skull bone, from the back, we can see two bones, that is occipital bone and parietal bone. For the scapula, we see 3 parts: spine of scapula, medial border of scapula, inferior angle of scapula. We also have muscles associated with them, so we'll see in our further slides. Then we have a vertebrae, as we have already discussed. The vertebrae is divided into 5 parts, that is cervical vertebrae, thoracic vertebrae, lumbar vertebrae, sacrum vertebrae, and the coccyx vertebrae. So in our examination, they might ask about the number of vertebrae. So remember, we have 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar, 5 sacrum, sacrum is formed by the fusion of 5 vertebrae, and the coxal, which is also known as the tailbone, it is formed by the fusion of 4 vertebrae. Moving forward, as we say that the gluteal region, we have the hip bone. Hip bone is also known as the coxal, and we have a 3 sub bones which make our complete hip bone, that is ilium, ischium, and pubis. Now, moving forward, now we have already studied about all the bony landmarks, or all the skeletal structures, or all the bones associated at the back. So now let's recall everything. First, we see it is the occipital bone. Second is the atlas. Third is the axis, which is our cervical vertebrae. Then fourth, we have a cervical vertebrae. As we say, we have a 7 cervical vertebrae. Fifth, we have the vertebral prominence, that is mostly located at C7. Then moving forward, sixth is our scapula. Then we have a thoracic vertebrae. Then we have a lumbar vertebrae, that is marked as 8. Then 9th is our hip bone, and 10th is our sacrum. So we have already cleared the entire skeletal framework. So now moving forward, this is the answer key for the image which we have saw. Remember, before starting the video, I say that we need to label one more skeletal framework. So the answer of that is in the next slide, that is this. Moving forward, now we understand what is the muscles of the back. So muscles of the back is broadly classified into two parts, that is extrinsic muscles and the intrinsic muscles. To differentiate this broad group of muscles, let us understand what is extrinsic muscles. Extrinsic muscles simply means the back muscles which lie superficially, and the intrinsic muscles which means the deep muscles. Now, let's give them the nickname. Extrinsic muscle is also known as the immigrant muscle, and the intrinsic muscle is also known as true back muscles. Now the question arises, why we say them, why we give them such nicknames? So the extrinsic muscle of the back is known as a immigrant muscle because they migrate during their fetal development. And in the further slide, we see that the extrinsic muscle is further classified, or we say further divided into two parts, superficial and deep. And the intrinsic muscle, which we say that is the true back muscle. What does this true back muscle signifies? It signifies that the function is to produce movement of the vertebral column. So therefore it is more specific. So we have classified the muscles into three broad categories, that is superficial, intermediate and deep. Moving forward, as I say, extrinsic muscle, we have divided into two parts, superficial and deep. So, continuing with the superficial extrinsic muscles, we have to remember the five main muscles that are trapezius, latissimus dorsi, levator scapulae, rhomboid major, rhomboid minor. Further, we'll see there are more muscles which contribute to the superficial at the back. So first label them all. First we see that we have a trapezius, then we have our latissimus dorsi, then we have a levator scapulae, and then we have a rhomboid major and rhomboid minor. Moving forward, extrinsic deep muscles, as we say, extrinsic muscle is divided into two parts, superficial and deep. So deep muscle is very easy to understand. We have the serratus posterior superior, serratus posterior inferior. Moving forward, now the question arises how to revise, how to learn this extrinsic muscle. So just be calm. We have a super amazing trick for this. First, I have already divided entire back portion into three main parts, that is the head, then shoulder and the arm. So let's just recall what all we can see at the back. Beginning from the head muscle, we have the sternocleidomastoid muscle, then we have a semi-splenoskipatus muscle. So to remember the head muscle, we have a 2S, that is sternocleidomastoid and semi-splenoskipatus. Moving down, then we have a shoulder muscle. So shoulder muscles are levator scapulae, trapezius, rhomboids. So to understand this or to learn them quickly, in the shoulder we have four muscles, that is levator scapulae, trapezius, rhomboid major, rhomboid minor. To learn, we have a trick. Let them study and revise. Moving forward, at the arm portion of we have for the few muscles more, that is latissimus dorsi, we have a deltoid, then supraspinatus, infraspinatus, teres major and teres minor. Let me clarify you one thing, that what this supraspinatus means. As we have saw already that the scapula has one spine in itself, that is this, we termed it as a spine of scapula. So it has a supraspinatus, which means the muscle which is present above the spine of scapula, and the muscle which is seen below the spine of scapula is known as infraspinatus. And we have the teres majors and teres minor. To learn the trick in the arm muscles, we have the trick let deltoid sit there. So we are saying deltoid to sit there. This is a diagram, or we say this diagram is from our most favorite book, that is a Netters. So here we can label all the muscles which we have studied in the previous, starting with the right, that is Spinous capatus, which we see in our head region, and the sternocleidomastoid in the head region. Moving down in the shoulder region, we mentioned trapezius, we mentioned the rhomboids, and moving further, we go to our arm muscles. There we have teres, we have latissimus dorsi, we have serratus supraspinatus, infraspinatus, and so on. So, hope you will enjoy this easy trick. Now, intrinsic muscle. Coming to the intrinsic muscles, if you remember at the beginning of the video, I say intrinsic muscle is very tricky to learn. So, intrinsic muscle is very important part of the back. It is divided into three, that is supraspinatus, infraspinatus, and the deep muscle. So coming to the intrinsic muscle superficial, we have the splenus capatus, splenus cervicis, and the erector. We have three erectors. So as we say, erectors are three. They are spinalis, longissimus, and iliocostalis. Moving further, this is again the diagram taken from the Netters. So we need to focus more on erector spiny muscle, as we have divided into three parts: iliocostalis, longissimus, and the spinalis. Moving forward, intrinsic intermediate muscle, we have divided into two S, that is suboccipital and the spinotransverse groups. So for spinotransverse group, we have a semi-spinalis muscles, multifidus muscle, and the rotators. When we see the diagrams, we come to know that we have further division of them. So basically, we are learning the basic part of this. So to learn this, we can have a trick, that is semi-multi-rotators, that is semi-spinalis, multi means multifidus, and we have the rotators. For suboccipital group, we have two OR, that is two obliquus capitis muscles and two rectus capitis muscles. So for obliquus capitis, we have superior, and obliquus capitis superior and inferior. For the rectus capitis posterior, we have rectus capitis posterior major and rectus capitis posterior minor. This is the task which you need to perform. Further, when we talk about intrinsic deep muscles, we have two eyes, that is interspinalis muscles and intertransverse muscle. Moving forward, this is the diagram view of whatever we have learned. That is, as we say, we have the interspinalis muscles, we have rotators, we have semispinalis capitis. We see that we have iliocostalis, longissimus. So here it is basically a diagram to make you understand. So finally we have a task, or we say a practice corner, that makes you perfect. In this corner, I have put some normal and some cadaveric images, and their solution is also present. See, cadaveric image, the answer of figure 1 and 2. Then we have figure 3 and its answer. And this makes my video end. So guys, this is all about the surface anatomy of back and the muscles of the back. So guys, if you like my video, so do like, share and comment, and don't forget to subscribe. Signing you. Bye.